Please welcome Dr. Nicole Shorrock.
Thank you, James. I'm going to bring it down a notch. I'd like to share with you a story. This is a story about an awakening. It's a story about a physician who finds herself in crisis, both personal and professional crisis. A crisis that causes an awakening to a new understanding of medicine that heals her family and ultimately monumentally changes the medicine that she practices. What if we knew we could reverse chronic disease? 7 years ago, my husband was diagnosed with MS, multiple sclerosis, a disease known to modern medicine to be incurable, requiring aggressive and expensive medications that, at best, slow a progressive neurologic decline. At the time of my husband's diagnosis, I had been practicing medicine for 10 years. Yet my story really started much earlier. As a young child, my earliest memories, I was always playing the mama. I was consumed with loving and nurturing babies. I loved everything that had to do with children. I was the president of the Babysitters Club. My favorite book was called Baby Island, where I was stuck on an island with babies. I dreamed that I would have 12 children someday, and when I was bored, I would think about how I would care for them, how I would make them lunches and tell them bedtime stories. And in my dreams, of course, my children thrived. What if we knew we could reverse chronic disease? And so it was both surprising and not surprising that I entered medicine with that same born passion, excited and eager to learn how to reverse disease, heal my patients, and ultimately foster a true sense of well-being. And I think, like most, I naively believed that my training would teach me how to do this. And so there I was, practicing up-to-date pediatrics, mastering conventional medicine to the best of my ability. And yet, honestly, over the next 10 years, I became progressively more and more frustrated as I witnessed more and more chronic illness in my children and my patients. I was frustrated because I didn't know why these illnesses were plaguing my patients, and I didn't know how to treat them. I had been trained to stop symptoms of an illness. I didn't realize that although treating the symptoms of the illness pacified myself, my patient, and their parents, it did nothing to reverse or stop the progression of the underlying disease. And more importantly, I didn't realize that these seemingly trivial childhood conditions, if left unaddressed, would progress to serious chronic disease in an adult. That is until my crisis, the classic dark night of the soul, when suddenly my husband, at the age of 37, who I thought was perfectly healthy, was diagnosed with MS. What if we knew we could reverse chronic disease? I imagine that other physicians will understand the sense of responsibility that we feel when one of our loved ones becomes ill. It's like we're called to respond to the best of our ability. I feel the same sense of responsibility with my patients, yet it took having the person closest to me to create a vulnerability that allowed me to open up and truly question all that I knew, what I had learned, and what I'd been struggling with for years. What if we knew we could reverse chronic disease? We found ourselves at the top MS center, hearing the neurologist talk about treatment options and prognosis. I'll never forget the appointment. I was terrified. Why was this happening? How did this happen? What's causing this? These questions raced through my mind, and I tried not to panic. I remember trying to calm myself. Remember, life doesn't happen to you, it happens for you. Look for the blessing. Surrender. And so when the neurologist said that my husband would need daily injections of immune suppressant medications for the rest of his life, I knew that wasn't right. And when he said nutrition didn't really matter, I knew that I couldn't put my faith in this approach to care for my husband. And so as scary as it was to leave or abandon the comfort of the known treatment for MS, I knew that's exactly what we had to do, and we did. At that point, I didn't know the formal functional medicine model, but I had been craving for years to find a medicine that addressed the root cause of illness. And I knew that integrative medicine had a holistic approach addressing the mind, body, and soul, and using time-tested treatments like nutrition, herbs, homeopathy. So we were blessed to find Terry Wall's nutrition guidance online, and we healed my husband's MS with nutrition, yoga, meditation, and a personalized approach to support his immune system. We reversed his chronic disease, something that I did not know was possible. And now that I had experienced it, I could accept nothing less from my patients. I dived into functional medicine. I explored integrative medicine, and I built that into my practice. You know when you hear something and it just resonates inside of you and you know that it's true? When I started practicing functional and integrative medicine, for the first time, my outer learning resonated with my inner knowing. And this was a powerful combination, and it created healing opportunities for my patients that I didn't even know was possible. And I am so thankful to be a part of. I'm thankful every day that I had a crisis, one where my world seemed to be crumbling around me, and yet it was a necessary mechanism for an uplifting to a newfound clarity. I'm thankful every day that I had an inner knowing to question the standard of care, and I had the courage to act on it. What if everyone knew we could reverse chronic disease? I tell my personal story because it's the one that I know best. But if there's something I know for sure, and there aren't very many things that I know for sure, I know that there are many stories like this. I've seen them in my practice, and I know that there will be many more as we explore a new medicine. Thank you.